us this afternoon. Very much appreciated. I'm very excited to be here. As you can see, the title of our presentation today, Enforcement Business Associates and Breach Notification. I'll be explaining a little bit later why we're discussing this in particular today. So now this webinar is being brought to you today by a partnership between Health Insight, the organization that I work for, Mountain Pacific Quality Health, the organization I used to work for, and HIPAA One and Healthy Nevada. And to give you a little bit more information about who we are and what we're doing, Health Insight and Mountain Pacific Quality Health are private, nonprofit, community-based quality improvement organizations that have dedicated more than 3 decades to improving health and healthcare, and are composed of locally governed organizations in Nevada, New Mexico, Utah, Montana, Wyoming, Hawaii, and Alaska. As part of our efforts to assist hospitals and providers with HIPAA compliance, Health Insight and Mountain Pacific Quality Health have formed HIPAA Privacy and Security Solutions, or HIPAA Pass. And our goal here is our organizations are nonprofit, and our goal here is pretty altruistic. We want to try to make HIPAA as easy, comprehensive, and affordable as possible for all covered entities and business associates, because it is a very important, it's a very important law, and in fact, we're going to go into why. Now, about HIPAA One, Mountain Pacific Quality Health and Health Insight, along with some other QIOs, did an extensive search for software programs that we thought might aid in our goal of making HIPAA easy and comprehensive and affordable, and HIPAA One emerged as a clear solution. You'll see there, you can see a brief video about the HIPAA One software solution at the link on the slide that you're looking at, but also my colleague Therese was kind enough to put that link in the chat box to the right. So, not at the moment, please, but at some point I do encourage you to go out there and watch that short video about HIPAA One, because it is the solution that we tend to try to steer people towards. So about me, I'm a certified HIPAA professional. I've got 15 years of IT experience. I'm incredibly proud of the fact that I have served as a Chief Information Officer at an FQHC. That was also partnered with a residency program, some of the happiest and best years of my life. And I spent 6 years as a HIPAA compliance officer. Much like each of you, I was voluntold that I was going to be the HIPAA compliance officer, and I remember thinking, well, okay, I'll do it. And then as I started looking into HIPAA, and I realized that it was a big deal. So it turned out that HIPAA was a lot more challenging than I thought it was going to be when I first agreed, or when I was first voluntold that I was going to be in charge of HIPAA. So one of my goals is to to help that experience not be as painful for you. So and I've spent 4 years as a HIPAA compliance consultant, and I've helped over 150 hospitals and clinics with HIPAA, and I've loved it. I love doing it. And I'm very excited to be here today, and thank you for letting me speak with you today. So now let's talk about what that title means, and so the title today, Enforcement Business Associates and Breach Notification, that is what we're going to talk about today, and I am going to be introducing you to those concepts and what you need to know and what you need to do about those concepts. But perhaps most importantly, from today's discussion, as a matter of fact, let me interrupt myself. In future webinars, in fact, our next webinar is tentatively, I need to be very careful when I say that, tentatively scheduled for June 28th. And that particular webinar is going to be, we're going to start talking about how to build and govern your HIPAA compliance program. And when we get into that, you're going to hear me say the same thing that many other people have said to you, which is that step one in HIPAA compliance is that you have to conduct a security risk analysis. And technically that is true. But as we know, as privacy and security officers and as the people in charge of HIPAA in our organizations, step one is really gaining buy-in from perhaps a provider. Perhaps you work in a single provider office, And HIPAA applies to you just like it does to the Mayo Clinic. But, and so you might be struggling to get buy-in from your provider or from your senior management team or from the board of directors. And you might be struggling to get buy-in from your staff as well. And so even though technically step one is to conduct a security risk analysis, step one is really to start gaining buy-in from your organization, because what we're trying to do with HIPAA, we're not trying to check off boxes, we're trying to create a culture of compliance. And the reason that we're trying to create a culture of compliance is because HIPAA fits very, very squarely in the middle of the patient care model. And let me talk about that for a little bit. So when we talk about where HIPAA fits in the patient care model, if I do not have confidence that you're going to protect my most private of information, then there's a good chance that I could delay or avoid getting care. And so that creates a barrier to healthcare, obviously. But I also, I want to try to appeal to you on a little bit deeper level. So I don't care if you find out that my vision is horrible, or I don't care if you find out that that I have a lot of fillings in my teeth. But I do care if you find out what types of antidepressants I might be on. Or let's go to the ultimate in HIPAA, in the need for HIPAA. If I'm having inappropriate thoughts, I'm considering harming myself or harming others, and I do the right thing and I go to seek behavioral health counseling. Well, if somebody finds out I'm on Xanax, that's an invasion of my privacy, and I'm not going to be real happy with that. But if I share my deepest, darkest secrets with somebody, especially in the form of a therapist's office, and those secrets get out, that could destroy my family, could destroy my life, could destroy my career. And we cannot rule out the possibility that it could lead me to consider harming myself or others. Now, I also want you to consider if this is a 13-year-old child. And on Friday, some of their most private thoughts, some of their most private medical issues have been released, and now they're out on Facebook, they're out on Twitter, Instagram, Snapchat, you name it. And how is that child supposed to go to school on Monday morning? So we have, those of us that are in the healthcare industry, not me in particular, I am far from the patient-provider relationship. But in the healthcare industry, we have the power to heal, but we also have an obligation to protect. And I know that the word privacy has just taken a beating over the last few years because everybody's tired of hearing about privacy, but we sometimes need to consider replacing the word privacy with dignity. And we need to protect these people's dignity, and we have to get buy-in from leadership and from the staff. We can't have you as the privacy and security officer running around with your HIPAA badge on, trying to convince other people to care about privacy, and as soon as you're out of sight, they're trying to skirt the rules. So today's session, in large part, is a lesson in how to potentially gain buy-in from your organization, so that when you need to get into the next steps, which is the security risk analysis, the risk management plan, putting in policies and procedures, that you'll have support instead of hurdles. So thank you for listening to me on that. So let's just dive right into enforcement key points. So before we go into that, on March, I wanted to give you some news on this particular topic. So on March 21st, the Office for Civil Rights announced that it's launching Phase 2 of its HIPAA audit program. So the 2016 Phase 2 HIPAA audit program is officially underway. And they announced that these audits will be primarily desk audits, although some audits will be conducted on site. So that means that they're going to send you information and ask you to confirm for them that you've done these things. So, and what they're going to do is they will, the 2016 audit process begins with verification of an entity's address and contact information. An email is being sent to covered entities and business associates requesting that contact information be provided to OCR in a timely manner. When I say OCR, I'm referring to the Office for Civil Rights, which is a department within the Department of Health and Human Services. So I'm sorry to toss out an acronym out there that you may not have been familiar with, but Office for Civil Rights. Them and the Centers for Medicare and Medicaid, they are the ones that conduct audits. If you're doing meaningful use, you're more likely to see CMS. And if you're not doing meaningful use, you're more likely to see OCR. An email will be sent to covered entities and business associates requesting their contact information. And then OCR will then transmit a pre-audit questionnaire to you to gather data about the size and type and operations of your organization. Now, just so you know, you can't just ignore the email and hope that everything goes away. So if an entity does not respond to OCR's request to verify its contact information or pre-audit questionnaire, OCR is expecting you to check your spam filters and your junk file filters. So communications from OCR will be sent via email and may be incorrectly classified as spam. If your entity's spam filtering and virus protection are automatically enabled, OCR expects you to check your junk or spam email folder for emails from OCR. So there is no excuse for saying that that it got lost, that we lost the email. So anyway, that's the latest news on the latest round of audit. Now that fits up here with what Jocelyn Samuels, the OCR director, said last February in an article for Health Data Management magazine. Speaking of Health Data Management magazine, it's a free magazine, and I'm a supporter of what they offer. I like their articles. Their articles are short and understandable. So if you're looking for journals or something that you might want to sign up for where you can get information on the healthcare industry, I've always found Health Data Management to be an easy magazine to read. So anyways, that's my way of suggesting that maybe you might want to consider it. So the last line of what Jocelyn Samuel says here is the key. That's a warning that the practice of imposing large fines and resolution agreements on organizations OCR believes have disregarded HIPAA rules will continue. And notice that they do mention the risk analysis in there, which is obviously one of the most important steps to HIPAA compliance. Also, I forgot to mention earlier when I was talking about myself, I do a very good job of keeping an eye on the chat box. So if you have a question that you want to throw in there, go ahead and feel free and send it in a chat. Otherwise, at the end of our call, we will open up the phone lines for phone calls. So thank you very much for that. So now let's talk about the fines. Now remember, our goal here is to gain buy-in from management and possibly staff. So first of all, we need to understand what the risks are. And here's what the risks are. And I want you to notice there's a lot of big numbers in there, and I don't know if that's the important part. The important part is in that left-hand category where it says did not know, reasonable cause, willful neglect, promptly corrected, willful neglect, not corrected. We need to talk about that for a little bit. So notice that, notice in the right-hand column, can penalty be waived by OCR? If it's considered willful neglect, no, the penalty cannot be waived. So that's very important to know because next we're going to talk about willful neglect. So violations resulting from willful neglect, defined to mean the conscious, intentional failure or reckless indifference to the obligation to comply with the regulations, will trigger the highest levels of penalties. Penalties arising from willful neglect cannot be waived. So here's why that becomes so important. The HIPAA privacy rule went into effect back in 2003, and the HIPAA security rule went into effect on April 20th of 2005. So that means it turned 11 years old less than a month ago. And the Office for Civil Rights and the Department of Health and Human Services says that if you haven't made significant progress with your HIPAA program in the last 11 years, that they're going to call that willful neglect. And so, and that's where we get bit. So if you haven't, if you don't have your HIPAA program fairly well established at this point, you could be in danger for willful neglect, and we're going to talk some more about that. So here's another scary aspect to all of this. Generally speaking, where multiple individuals are affected by an impermissible use or disclosure, such as in the case of a breach of unsecured protected health information, the number of identical violations of the privacy rule standard regarding permissible uses and disclosures will be counted by the number of individuals affected. So that means that if you have a breach that involves 1,000 patients, that's 1,000 violations. And then if we go back to that previous chart, it shows that how much you can be fined for each violation. So, so a breach is not a breach is not a breach. The number of victims that are affected are going to affect the size of whatever fine that you might receive. Now, there's another word that I want us to focus on in here, and it's not highlighted. That word is unsecured, such as in the case of a breach of unsecured protected health information. In our next webinar, we're going to go very much into what unsecured means, but if it's been encrypted or if it's been destroyed, then it's considered secured. So if you have a laptop that comes up missing or a jump drive that comes up missing and it was encrypted, well then it's not a breach because it's not considered unsecured protected health information. So that's just a little sidebar on that subject. So more enforcement key points. The Secretary must formally investigate complaints indicating violations due to willful neglect and impose civil penalties upon finding said violations. The investigation is triggered if the initial facts show the possibility of willful neglect. So there's, unlike getting pulled over by a highway patrolman, there's no probable cause. There's, we think you might. And so then they get to kind of come after you for that. So those are some very important points that you and your organization are going to want to keep in mind. So now the definition under 160.312 allows the Secretary to move directly to a civil penalty without exhausting informal resolution efforts, particularly in cases involving willful neglect. That is fairly new. For a number of years, the Office for Civil Rights was strongly encouraged to try to work something out. With if somebody wasn't in compliance, to come to a win-win scenario. But now that it's 11 years old, they're just moving directly into the penalty phase of things. So and then HHS, or Office for Civil Rights, so HHS stands for Health and Human Services, on a case-by-case basis may expand any preliminary review and conduct additional inquiries for purposes of identifying a possible violation due to willful neglect. The HHS Secretary can coordinate with other law enforcement agencies on actions as well. So it kind of means that once you allow them to get in the door, they're free to go wherever they want, and they're free to invite their buddies to come and join them if they think that there's business for the FTC or the State Attorney General. So these are all things that that we need to keep in mind as we move forward. Now, this is changing too. An organization's history of HIPAA compliance is relevant to the determination of the civil money penalty. Now, for years and years and years, we used to talk about good faith effort, and the federal government talked about good faith effort. And if you showed you were putting up an attempt, then they were far less likely to give you a fine. They were more likely to give you a corrective action plan. So if you get audited, chances are you're going to end up with, at the bare minimum, a corrective action plan. But what we want to avoid is a fine. Now, so that good faith effort is losing strength, and is being replaced by, we want to see demonstrable proof of compliance. So I feel like in some regards, the honeymoon has ended. And now it's just down to you have either gotten this done or you haven't. So now business associates. So that's kind of the key points on enforcement. Now I do want to go into business associates for a while because there's a lot to learn about business associates, and we're going to talk about why they're in the middle of this discussion as well. Because what we're trying to do is we're trying to get buy-in, and you're going to need to get buy-in from your business associates, and you're going to do that via a written contract. But you need to get buy-in from your staff and from your leadership as well. So so some of the things, latest news on business associates. For instance, the Office for Civil Rights announced a $750,000 settlement with Raleigh Orthopedic Clinic of North Carolina on April 20th of 2016, which is the 11th anniversary of the security rule by coincidence. And it resulted from a breach involving an undocumented business associate. And they put undocumented in quotes. The settlement comes just as desk audits are expected to begin. And what happened there is the third-party vendor, Raleigh Orthopedic Clinic had a third-party vendor orally agree to convert the clinic's x-rays into an electronic form in exchange for harvesting the silver from the x-rays. And so, and as OCR Director Jocelyn Samuels mentioned, HIPAA's obligation on covered entities to obtain business associate agreements is more than a mere check-the-box paperwork exercise. It is an active part of HIPAA compliance and one that cannot nor should be ignored. And the settlement is a good indicator of an issue that OCR will look for in its audit process. And so we're going to talk a little bit about business associates, but this also helps us to understand why we need to talk about business associates, because they are going to be a topic of conversation if you get hit with a desk audit or an on-site audit. So something to keep in mind there. Now, as we go into and we start talking about business associates, first of all, let me clarify. The privacy rule regulates covered entities, not business associates. The rule requires covered entities to specify in a business associate contract that the business associate must make such must protect PHI, must protect protected health information, and it'll tell them how to do it and when they can release it. So if you look at, and what we're referring to here is the Omnibus Final Rule that came out in 2013. I have a copy of the regulation that shows the markups. You know how in Word you can go in and turn on Show Markups. Well, if you turn on Show Markups to the actual federal regulation, you will see under the security rule where what they basically did was they added the words business associate to each of the 53 standards and implementation specifications. So as far as the security rule goes, business associates must comply with the security rule. They also must comply with all of the breach notification rule. Where the difference comes, the biggest difference between a covered entity and a business associate is a business associate will only have to comply with the privacy rule insofar as how it is outlined in your business associate agreement. So because the privacy rule regulates covered entities, but the covered entities are required to pass on those requirements to their business associates. I hope I was able to explain that clearly. So usually I'm teaching in front of a class and I can kind of tell, I can see eyes glazing over and stuff like that, but in this particular instance I can't. So, all right, so what is a business associate? So broadly speaking, a business associate is somebody that is not on your payroll that by design has to have access to your protected health information, to your patient information. So if they're not on your payroll, but they need to access your patient information, then they are a business associate. And examples of a business associate would be a billing service. A lot of us outsource our billing services. It might be your IT support. Since they have access to your server, they might need to get into your EHR or your software programs. Those are going to be business associates because by design, they will be accessing your patient information. So that's the broad definition of a business associate. Now, business associates are directly liable under the Omnibus Final Rule of 2013 for uses and disclosures that violate the privacy rule or are in breach of the business associate contract. So, and it's the business associate, so the business associate contract is going to state that they are required to follow the privacy rule. And then you're going to determine what parts of the privacy rule they're going to follow. So, and the thing to keep in mind here is that a failure on their part could lead to a hit to your reputation. So, so just something to keep in mind that you can transfer responsibility, but you can't transfer the effects of a breach, even if it's from a business associate. It can still have a negative impact on your business, and that's certainly something that we want to make sure that we avoid. So. Now, BAs are not permitted to use or disclose protected health information. If it would be a privacy rule violation for a covered entity to do so, except that a BA may use PHI, protected health information, for its own management and administration. So I encourage you to go and download the example. There's a sample business associate agreement out on the HHS website. And in fact, it's going to be on our website here within the next day or so because it should already be there, but we still need to add that. And if you download the business associate template that they have, the very first page really outlines very well the rules and requirements of being a business associate. So I want to encourage you to download that. If you want to wait a day or so, we'll get that added to our website. And just so you know, since we're on the subject, we do have our HIPAA Pass website. You can find that at healthinsight.org/HIPAA Pass. And HIPAA is spelled with 2 A's. And after today, you will never, ever, ever forget how to spell HIPAA because HIPAA ends in AA. And so you'll never forget that forever now. It ends in AA, which obviously stands for anodized aluminum. Anyways, trying to be funny there. All right, now this is a scary thing. This is where, do we need a BA for a clearinghouse? No, you do not, Lisa. So a covered entity, that's a great question, and I wish I had covered it earlier. Thank you, Lisa, so much for that. So a covered entity is considered to be a provider, a healthcare clearinghouse, or a payer. So those are the three entities that HIPAA applies to. And then when you get into business associates, the HIPAA rules apply to them once you start doing business with them. Now let's talk about this screen because it fits perfectly. A person or entity becomes a BA by definition, a business associate by definition, and not because there happens to be a BA contract in place. Therefore, liability attaches immediately when a person creates, receives, maintains, or transmits PHI on behalf of a covered entity. Now, this kind of fits in with what our mission is here, because this, if you're in a large organization, you can absorb costs much easier than if you're in a small organization. But much of the West, which is where HIPAA Pass is primarily located, is in the West. We have a lot of small towns, and we have a lot of not just solo practitioners in these small towns, but we also have a lot of people that work out of their home and provide billing services for a clinic or two. And regardless of size, these organizations have to be HIPAA compliant, as I mentioned earlier, just as the Mayo Clinic does. And so if you've got someone named Janine that decides she's going to open her own billing company, and she's going to do billing for your clinic, she has to be HIPAA compliant on day one. She doesn't get to start doing your billing for you and then she's got a 6-month leeway to become HIPAA compliant. She has to be HIPAA compliant before you start doing business with her. And then she has to sign the business associate agreement that says that she is HIPAA compliant and that she will remain HIPAA compliant. And so when I talk about creating a culture of compliance, this helps to explain why it has to matter to everyone involved. Because people are going to get hurt, whether it's the patient getting hurt or the practice getting hurt, or your friend that you outsource your billing to that has her own business. If we don't do this right, we risk a lot of people getting hurt, and sometimes those people getting hurt don't even know that they were in danger to begin with. And so that's why I'm trying to implore that we get going on this, and that we all decide that we've got to do this, and we're going to do it together, and we're going to do it right. And I hope that I can help, and I certainly hope Health Insights can help, and Mountain Pacific Quality Health as well. So now BAs, business associates, are now directly liable under the HIPAA rules for impermissible uses and disclosures. Let's talk about that for a minute. This is going to come up in future webinars as well. So the difference between a use and disclosure is an impermissible use means that PHI was wrongfully used within the organization. So there is a specific definition behind uses, and then disclosures is when it's been released to somebody outside the organization. So if it's an impermissible within the organization, impermissible, let's call it access. If it's impermissible access within the organization, that's considered a use, and if it's outside the organization, that's a disclosure. For failure to provide breach notification to the CE, so you're going to want to talk about this with your business associates. If they have a breach, what are they to do and when are they to do it? You might want to bail them out and share with them your breach notification policy, and then just say, hey, we would just soon you incorporate this policy as your policy, and that way if something happens, we're all on the same page. For failure to provide access of EPHI to the covered entity. Now let's talk about that for a moment. So of course, if I as a covered entity, if I'm a provider, oh, hi Shannon, hold on just a moment. Do the labs we use need to sign a BAA? No, LabCorp is actually is going to be a covered entity. So so you're dealing with covered entity to covered entity in that particular regard. So I hope that answers your question. Thank you, Shannon. So for failure to provide access of EPHI, and let's talk about EPHI for a second. All that E stands for is electronic. So if it's under the HIPAA security rule, it'll oftentimes be called EPHI, because anything that falls under the security rule is electronic. All of it falls under the privacy rule, including the security rule. So under the privacy rule, it doesn't matter whether it's oral, written, or electronic, whereas the security rule focuses entirely on electronic. So for failure to provide access of PHI to the covered entity. Now you can put in there, you could put in here, or the individual, because you're, you might decide that it's okay for your business associate to provide access to protected health information to an individual. But most organizations do not do that. Most organizations say that, that if a patient wants access to information, we want them to have to go through us, because we're going to have the most complete set of information. Now, there might be times where you as a covered entity will want to reach out to a business associate because there might be some additional information. But most organizations will have in their business associate agreement that any access to PHI requested by a patient must be redirected to the covered entity. So that's just something to keep in mind. And then number 4, for failure to disclose PHI to the secretary. Obviously, if they're doing an investigation, you can't tell them that they're not allowed. And for failure to provide an accounting of disclosures. So once again, that might be a moot point because in your business associate agreement, you might decide that an individual cannot go to your business associate and ask for an accounting of disclosures. Maybe you'll have in your business associate agreement that you will ask that DA for an accounting of disclosures, and then you'll pass it on to your patient. It just gives you more control over the situation. So 6, for failure to comply with the requirements of the security rule. Notice right there, the entire security rule is under the responsibility of business associates. So they need to know that, which means that just as I'm telling you that you must have a security risk analysis done and you must have a risk management plan, that business associate is required to do so as well. So I'm asking you to maybe consider calling us to talk about security risk analysis work, but you might also want to consider having your business associate call us as well. You're actually looking out for their best interest. So business associates must comply with the minimum necessary principle. That we're going to be covering in future webinars. The simplest way for me to look at the minimum necessary principle is I think of it in military terms. I was in the military for 7 years. And in the military, you had to have the right security clearance, and you had to have a need to know. And the minimum necessary principle is the same thing. Do you have the right clearance to look at that patient information? And do you have a need to look at that patient information? And that's basically what minimum necessary talks about. Now, BAs are required to have a business associate agreement with their subcontractors who use PHI on their behalf. And BAs must monitor their business associate agreements with their subcontractors. And then requirements in business associate agreements cascade all the way down. So there is no open loophole. You can't outsource your work in such a way that that patient information is compromised. It cascades, it trickles down to everyone involved. So if you are outsourcing your billing to a billing organization, then you have to have a BA with them. And if they're outsourcing their paper shredding to A to Z paper shredders, then they must have a business associate agreement with A to Z paper shredders. So these are conversations that you're going to want to be able to have with your business associates. So let's wind this up on business associates, and what do you need to know? So do you have a business associate management program in place to ensure that you are in compliance with the business associate portions of the HIPAA privacy and security rule? Have you identified all of your BA arrangements to establish an action plan to address any deficiencies in documentation or compliance? Let's talk about that for a moment. If you go to the Health and Human Services website, you can actually do a search on a listing of business associates, and they'll have an Excel template. And you can use that in Excel template, which is incredibly simple. So if you don't want to waste your time, you can create your own Excel template. And basically, you're using Excel to make sure that you have an inventory of all of your business associates. That way, if a new rule or something comes out that affects them, that you have an easy and organized way of making sure that you get in touch with them and you can let them know. So you should have an Excel spreadsheet available that identifies all of your business associates, because many of you will have a lot of them. So, hi Billy. So will the slides and recording be available after the presentation? Absolutely. I'm not sure how long it takes to get the slides and the recording out on our website. I'm hoping it's a day or so. But yes, they will be posted out there. And once again, it's healthinsight.org/HIPAA Pass. And so I do invite you to go out there. And also a copy of the full regulation, the 115-page regulation, a copy of that is out on our website as well as some other valuable materials. And we're going to be adding a few things. So we're going to add that sample business associate agreement. And also we're going to add to our resources on that website a business associate flowchart. That flowchart takes all of the question out of whether somebody is a business associate or not. You just walk through this flowchart and it will tell you. Do we need a BA for research? Oh, you're getting into some stuff there. You do not necessarily need a business associate agreement for research, but you may need to have a data usage agreement. And then also if you're going to do research, you're going to have to decide if it's going to be de-identified ahead of time. If you de-identify it on your end, that means it's no longer PHI because it's medical information, but it can't be tied back to an individual. So you can de-identify it and send it off to a research organization, or your best bet is to make sure that you have a data usage agreement. So keep that in mind. Now, and if you want, Jody, I want you to feel free to call me or email me. My number is 307-258-5322, and that's on a slide at the end. I can send you some more information about if you're going to be getting involved in research. So, all right, so that second bullet point that we talked about, so make sure you have an Excel spreadsheet that identifies who all of your business associate agreements are with. And then also the other thing is, as of the Omnibus Final Rule in 2013, you are required to develop new business associate agreements, and you are required to have that done by September of 2013. So if you don't know if you've updated your business associate agreements, all of them, within the last 2 years or so, then you're going to want to get that done. So those are the things that we want to make sure that we know about business associates, and we'll be going into that much deeper in future webinars. All right, so let's move on to breach notification. Dun, dun, dun. Oh, here's a link to our website right there. So, so breach notification, let's talk about this for a minute. So on our website is that full regulation text, and you can see where I tell you to go to page 71 of the full regulation text, which is on our website. The reason I'm telling you this is, so there's three portions to HIPAA. There's the privacy rule, there's the security rule, and there's the breach notification rule. And breach notification is actually only about 2 pages, maybe 2.5 pages, sandwiched in between the security rule and the privacy rule. Now the privacy rule and the security rule are almost unreadable. My complaint about the security rule is you get this 10-word paragraph, and from this 10-word paragraph, you're supposed to develop policies and procedures from it. And then the privacy rule is so broken up, I think like 45 pages is dedicated to the privacy rule, and it's just so discombobulated and broken up that it's very hard to read the regulation on privacy and get any real understanding. However, the breach notification rule is very readable. So I do want you to go to page 71 of the full regulation text, print out those 2 or 3 pages, and then build your breach notification program around that, because it's readable and it's understandable and it tells you pretty much exactly what you need to do. So, so keep that in mind. And also, just as further education, when you see that subpart D, so CFR 45164.400 subpart D, subpart C is the security rule, subpart D is the breach notification rule, and subpart E is the privacy rule. And 164. That 164.400, well, 164.300s, those are the security rule. 164.400 is the breach notification rule, and you guessed it, 164.500, those identify the privacy rule. So just a little something there. Don't get too intimidated when you see all this 164.400 subpart D. In typical government fashion, they probably made that more difficult than they needed to. I see we're at 1:45, so I probably better get scooting along. So when you're going through that breach notification, you're going to see where it tells you how to, identifying when a breach occurs, securing PHI. So after a breach is secured, obviously you've got to make sure that you mitigate, you go into damage control. And then you're going to have to notify individuals, including timing, content, and providing substitute notice. So you're going to have to reach out to all those, and if it's less than 500, you're going to have to reach out to them and let them know that there was a breach. And so it tells you how you are required to do that. And then you're going to have to notify Health and Human Services. Even if it's only a breach of one person, you're still going to have to notify the Department of Health and Human Services that you had a breach. And so the most likely person to turn you in for a breach is going to be yourself, because you're required by law to self-disclose. And notice at the bottom of that slide is, so if you have a breach at some point, at any point during 2016, if you have a breach, you'll have to notify, and if it's less than 500 people, then prior to March 1st, you're going to have to notify Health and Human Services by going to this website that you see down below. If it involves 500 or more people, then you're going to have to take action immediately. And if you do have to, so if it does involve 500 or more people from one state, to be more exact, you're going to have to do a notice to the media. And that means you're going to have to put a notice in a prominent local newspaper. And that's obviously going to affect your reputation. And then notice by business associates, you need to put in there what they're required to do if they have a breach on their end and when they're required to notify you. And then obviously there could be a delay in notice if there's if law enforcement is involved. So. All right, so what do you need to know about breach notification? So so the questions you need to be able to answer is, have you reviewed your breach notification policies and procedures in anticipation or with the new definition of a breach? And what they're talking about here is prior to the omnibus final rule, in order for something to have been determined to be a breach, you had to show that it was going to hurt somebody. Well, now that's no longer true. You don't have to put somebody in harm's way for it to be a breach. It's a breach if it's been released. But they replaced it with low probability of compromise. For instance, if you lose a laptop and you find it a half an hour later and it turns out it was in somebody's office, still in the clinic, there's a low probability of compromise, and so it's not a breach. So now this brings us to have you developed a methodology for assessing the determination of the low probability of compromise using at least the 4 factors provided in the breach notification rule? Let's talk about there's security risk analysis, which you've been hearing a lot about. Everybody tells you have to get a security risk analysis. And then there's a risk assessment. And a lot of people use those two terms interchangeably, but in reality, a risk analysis is the overall evaluation of your security and your privacy. An assessment, if you're doing a risk assessment, that applies to when you're doing this investigation to determine if something was a breach or not. So, so if you have a potential breach, you're going to do a risk assessment to find out if there's a low probability of compromise. And that's also in those regulations, those 4 factors. So, and do you have written policies and procedures and a process in place for notifying affected individuals, the media, and the Secretary of Health and Human Services of breaches within the required time frame? So don't wait until you have a breach. That's I've had a lot of clients. They call me up, and they've had a breach, and now they're wondering what policies and procedures they need to have in place and what they need to do. And of course I help them, but it's a little too late at that point. So so they're in a little bit of trouble. All right, so we're starting to wind down now. Our HIPAA Pass webinar series will continue in June. Typically, we're going to try to hold them towards the end of the month. I want to say that building and governing your HIPAA compliance program is going to happen on June 28th, but I have been told that we cannot confirm that date yet, and so so just keep it tentative that June 28th will be our next will be our next webinar, and I certainly hope that all of you can join us. And then also, we are going to be in the Salt Lake City area conducting a series of one-day HIPAA boot camps. These will be training for privacy and security officers. And what it boils down to is we take a privacy officer job description and we take a security officer job description and we go through each of those lines, and by the end of the day, you're going to know how to fulfill each of those lines within that job description. So the cost on that is, it's not on the slide here, and I apologize for that. It's $219 per student, and we'll be sending out Save the Date, a constant contact for Save the Date, and also I think we'll be doing some fax broadcasting. So please keep that in mind. And with all of that in mind, here's my contact information. I want you to feel very comfortable calling me if you have any questions. I enjoy talking about HIPAA and I enjoy helping people. So, so please feel free to call me or email me. And then also, once again, I'll encourage you to visit our website at healthinsight.org/HIPAA Pass. And with that in mind, we will get ready for the question and answer period. Sherry, are you still there?
Thank you. We will now begin the question and answer session. If you would like to ask a question, please press star and then 1 on your touch-tone phone. If you wish to remove yourself from the queue, you can press the pound or hash key. If you're using a speakerphone, you may need to pick up the handset first before pressing any numbers. Once again, if you'd like to ask a question, please press star and then 1 on your touch-tone phone. Standing by for questions. And then while we're waiting for any audio questions, did you have any more web questions?
Mark?
Yes.
There was a question on the chat that they sent through the presenters line, and it was from Janice. And she said, how can I find out more about the Health Data Management Free Magazine?
Oh, just Google it. And you can get that in a paper format, or you can get that in electronic format. I like to relax when I read, so I get the actual magazine. And I think you'll find it very, very helpful. In fact, in our next webinar, let's make that a point. I will try to provide a list of resources that I think people should consider. So, so let me make a note on our next webinar too, and then we'll add those. We'll be adding more resources to our website, and I encourage you to go out there and look at it. Thank you for that.
Okay, that was all we had in the chat.
Okay. Otherwise, it's crickets.
I'm showing no audio questions.
Okay. Well, with that in mind, we'll let everybody go, and you'll have 7 minutes to spare to get to your next meeting. I want to thank everyone very much for joining us. Oh, do we need to report an old? Oh, do we need to? Yeah, Lynette. Give me a call, Lynette. We should talk about that. Yeah, we'll need to. We'll have to talk about how old, because HIPAA, you can actually go back. If a patient has a complaint, they have 6 months to file their complaint against you, but a HIPAA investigation or a HIPAA violation can actually go back 6 years. So so that's something that we would want to talk about. Are there? I'll stay on. I tell you what, we can let everybody go, and then I'll stay. On the chat room will still be open for a few more minutes if somebody does have a question. So Lynette, my phone number is, oh, you see it up there, 307-258-5322. And with that, I want to thank everybody for joining us today. I really enjoy doing these webinars, and I know it's HIPAA, and I know it can be a little bit dry, but I really enjoy doing them, and I really appreciate everyone that joined us today. So with that, I will wish you a wonderful day. Thank you very much.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.